3500, is that Dave Bryce?
It is.
Got it. Yeah. Thank you.
You're welcome.
Is there a particular place?
Yeah, so I was going to say, because you're usually not here, you sit closer to these mics unless you're able to kind of project your question.
Even if you are, still good to be.
Yeah. No complaint. All the mics are fine, by the way. Just keep that in mind. Oh, yeah, no problem.
Well, good morning. We'll go ahead and start this morning with an update on the numbers. Today we had 96 new positive cases for a total of 1,995 positive cases. No new counties, so we have 82 total counties. 407 negative cases today for a total of 17,874 negative tests. The State Hygienic Lab has 3,048 tests available. We have 908 Iowans that have recovered for a recovery rate of 46%. And I am sorry to report this morning that we have had 4 additional deaths. 1 elderly adult in Polk County, 1 elderly adult in Clayton County, 1 older adult in Alameda County, and 1 older adult in Johnson County, for a total of 53 deaths in Iowa. The Department of Public Health has also confirmed 1 additional long-term care outbreak at Wilton Retirement Community in Muscatine and this county, and this brings our total number of long-term care facility outbreaks to 7. More than 10% of Iowa's total number of positive COVID-19 cases and 49% of our deaths are related to long-term care outbreaks. All deaths in Iowa are among older or elderly individuals and those with underlying health conditions, again underscoring the importance of doing our part to protect our most vulnerable population. Today, the Department of Public Health is sending testing supplies to Wilton Retirement Center so that additional residents can be tested. We are also sending an additional 900 tests to the Tyson plant in Louisa County, and this will be in addition to the 200 tests that were sent last week. I also want to provide a look at the RMCC data from a statewide perspective this morning. As we announced yesterday, the information is now available on a new online dashboard at coronavirus.iowa.gov. Across all of our RMCC regions yesterday, there were 171 COVID-19 patients hospitalized. 20 were admitted in the last 24 hours. 78 patients are being treated in ICUs, and 43 are on ventilators. Also, in hospitals across the state, there are 7,930 inpatient beds, 533 ICU beds, and 718 ventilators that are available for patient care. You can easily access the same information by region on the dashboard at coronavirus.iowa.gov. Last week, we discussed the emerging issue of newly food insecure Iowans and unintended consequences of the necessary mitigation efforts that we've implemented to slow the spread of COVID-19 in our state. And today, I want to shine a light on another important issue, and that is abuse and neglect. At a time when it's critical that Iowans stay home as much as possible to prevent being exposed to the virus or exposing others, we must also recognize that home is not a safe place for all Iowans. Data from past disasters show physical and sexual abuse, as well as domestic violence and substance abuse increases along with the stress on families in these types of circumstances. Anecdotal information nationwide suggests that it is happening now due to COVID-19 pandemic. So for anyone living in an abusive situation, including children, staying home means that their abuse or neglect may be going unnoticed by those who might otherwise be able to help them. With schools out, children are separated from the teachers and caregivers who might see the signs and report them. And today I've asked Kelly Garcia, who is the director of the Department of Human Services, to join me and help raise awareness of child welfare during this time and the role that we can all play to ensure that Iowa's children are safe and well. Director Garcia?
Good morning, and thank you, Governor, for inviting me to speak today. I'm Kelly Garcia, and I have the pleasure of serving as the Director of the Department of Human Services. First, I want to thank the Department of Public Health and the Emergency Management Team for keeping us informed during this pandemic. While they focus on public health and emergency response, I'm here today to talk to you about the human side of our state's response. We are, after all, the Department of Human Services. And we know that Iowans are going to need us now more than ever. Many, for the first time, may find themselves in the need of our assistance, either medical or economic assistance. And so first I'm going to talk to you about our agency's overall response, and then I'm going to talk to you more specifically about child welfare. Before any confirmed cases of COVID-19 in the state of Iowa, DHS began analyzing our operations across the agency. Our leadership team quickly mobilized to assess our emergency response protocols and equip our team members and our community partners to be safe and to tailor these plans to this unique emergency. DHS is an agency that is truly impacted top to bottom by the COVID-19 pandemic. The pandemic has, of course, impacted the way our facilities operate. Anytime there is a disaster, mental health needs for Iowans change. We're ensuring that the needs of our current Medicaid members are met, and we know that more Iowans will seek medical, food, and economic assistance. This really has changed how we do our work, but the important thing is that we do continue to do our work. Iowans are going to increasingly rely on us in the days and months to come. I'm thankful to my entire DHS team for stepping up. More than half of you continue to be on the front lines, some who are invisible to these efforts, like our financial services team and IT team. Each one of you have demonstrated heroic efforts. And although we have shifted our operations, Team DHS stands ready. Stressors are a part of everyday life. But our inability in this emergency to access our normal social supports in the way we are used to makes things feel harder. Under the best of circumstances, parenting can be a daily challenge. While many are taking this time to add precious memories at home, we recognize that not everyone in our society can telecommute from the safety of their home while doing Pinterest crafts with their children and making precious memories. Many parents don't have those resources. They don't have jobs where they can telecommute. They may be a single parent or a head of household with working multiple jobs on the front lines. Their children may not have access to internet to participate in educational activities, and now they may have reduced access to food. We know many Iowans and families live paycheck to paycheck, maybe barely, many of whom faced great challenges in previous disasters and now have the added stress of economic hardship and general uncertainty in this pandemic. We need to support these families and those individuals who live in the margins, and we're doing everything we can on our team to ensure access to our critical supports for Iowans who depend on us. Here are some of those highlighted efforts. For Medicaid and food assistance, we've removed barriers to ensure continuous coverage. We've suspended all premiums and copays. We've expanded telehealth. And we're also working to stand up access to COVID-19 testing for those who remain uninsured. Beyond these supports, we're also working on expanded behavioral health supports. If you know of a family or your own family needs these supports, please contact us. All available resources are listed on our website. We also need to understand how overwhelming stress can be for family, regardless of means, and how this can increase the rate of abuse and neglect. Some families, as the governor mentioned, might even be at home with their abuser. At DHS, we're paying very close attention to abuse reports, which sadly have dropped. To be clear, as the governor mentioned, we don't believe that abuse has gone away, but the reports have. Teachers, doctors, and other mandatory reporters are not seeing children and vulnerable adults like they normally would, and this is concerning. While we're monitoring this closely, we're also raising awareness. We're working closely with the Department of Education, with superintendents across the state, encouraging comfort calls to check on students. We're also putting out the call to communities, neighbors, faith-based organizations, and all Iowans. If you hear something or see something, say something. As Governor Reynolds tells us, we all have our part to play in this response, so we're calling on you. Pay attention to the sounds in your neighborhood. Reach out to the children and vulnerable adults in your life by phone or video call. Make sure they know that they're supported, loved, and listened to. If you believe someone is in imminent danger, call 911 immediately. And if you suspect someone, a child or dependent adult, is being abused or neglected, please call our abuse hotline. The number is 1-800-362-2178. We're available 24 hours a day, 7 days a week. To the families we serve and to each of you, I want you to know how deeply humbled I am to serve in this role and how very seriously I take the charge to ensure every family in Iowa has access to the supports necessary during this critical time. I'm proud to support Governor Reynolds in her mission to help put Iowa's families first. Thank you for your help as we all do our part.
Thank you, Governor. Yeah, thank you. Thank you, Kelly. And I want to thank the entire team at the Department of Human Services who are working to ensure that important services continue for Iowa families during this really challenging time. I also want to recognize the Department of Education, as Director Garcia indicated, and school districts across the state who stood up their summer meal programs early to ensure that school-age children continue to benefit from healthy meals each day. On that note, I do want to share some good news. Last week when I told you about the challenge that food banks across the state are having to meet the growing demand, Iowans really stepped up. The Food Bank of Iowa reported that during and after the press conference, their phones were lighting up with Iowans calling to ask what they could do, from donating food to volunteering on site. Corporate partners also stepped up. We had Walmart delivered a truckload of cleaning supplies. Casey's donated 30,000 pounds of packaged lunch meat. And Ruan is helping facilitate transportation needs so that the food bank can double its distribution routes. This is a time when all of us must do our part to protect our fellow Iowans, whether it's staying home or social distancing to slow the spread of the virus, or recognizing when someone is in need and answering the call to help. Iowans are known and respected for doing the right thing. So thank you for being a force of good during these really difficult times. And with that, we will open it up for questions.
Governor, state data shows that Black and Latino Iowans are disproportionately testing positive for COVID-19. What are you doing to address that?
So we're still looking at the trends. I'll have Sarah go ahead and talk about that, but I think it's consistent, maybe not at the higher rate that we're seeing in some of the states across the country, but we still are analyzing some of the data.
Yeah, so I think that we are just still in the process of kind of analyzing the data. I think what we're seeing in Iowa is consistent with what we have seen, across the country in terms of increased rates. And I think that, some of the reasons and the explanations for some of those increased rates are that we know that there's a higher incidence of underlying health conditions that make these particular populations more susceptible to more serious COVID complications. We also know that we have larger numbers of these populations that work in businesses that have not been ordered to close at this time, such as food manufacturing businesses. And then we also know that there's a higher incidence of more density in housing among these populations. That does make isolation during illness more difficult and increases the risk of the spread within a household where we know the virus does tend to spread quickly and easily. And so some of the things that we are doing, we're continuing to work on providing instructional materials in alternate languages and trying to reach out specifically to some of these businesses where these individuals may work. And so we're continuing to try to do everything we can to provide as much information as possible so that we can protect all Iowans and make sure that everybody understands where they can go for help, that they should seek out medical attention if they do feel ill. And if they have questions that we can answer, we'd encourage them to reach out to the health department. We want to provide support for everybody. Thank you.
Sarah or Governor, on this point about food processing, given this question I just asked, obviously you were talking about additional testing being
Yeah.
sent to Southeast Iowa. Is the state asking private employers of this nature of plants to report COVID-19 cases to the state? And if you're not, are you going to start doing that?
Well, actually, they sent out some business guidance last week, and they kind of aligned it with what we ask schools to do during flu outbreaks, and that's if you see over 10% of your population that's ill, then they are to contact the Department of Public Health so we can start doing an assessment and asking some of those questions. But believe me, they know that this is an essential, especially in some of our food packaging and processing plants, this is an essential infrastructure. This is about feeding not only Iowans but the world, and so they know that they have a responsibility to take care of their employees. They, for the most part, are trying to be proactive in providing the right kind of protective gear, to doing assessments on the front end, to doing temperature scans. We have an additional 900 tests that will be going down to the Tyson plant today so that we, again, can get the scope of what we're looking at, start to, the process to see who's been who has tested positive, how we can do the contact tracing so that we can start to understand who they've been in contact, who potentially could be impacted, an additional positive test, and so we'll have a better idea once we can look through the additional tests that have gone down there. But the Department of Public Health also has been in constant contact with a lot of these facilities to walk through what they are doing, if there's additional things that they need, and how we can be proactive in getting in front of it. I've talked to several of them. I'll be calling the balance of them today just to get an assessment on what they're seeing, where they're at with some of the protective and preventive measures that they're putting in place, and just talk about how we can continue to always try to be on the front end of that and identifying positive cases before it starts to become significant and then really problematic for keeping the facility up and running and processing food, which is so, so important.
That southeast region has really been at the moment because of packaging
I think that probably has, do you want to talk? It's 8. So the Southeast Region 5 is an 8 today. Region 6 is a 9. Region 2 is a 7. Region 1, which is the Des Moines area, is an 8. Region 4 is a 6. And Region 3 is a 4.
So this seems odd because of that huge spike in that Columbus Junction, that would be more higher in that region.
Do you want to talk? Yeah.
Yeah, so case rate is one of the factors that we look at when we're doing that, kind of assessment score. The other thing is the rate of hospitalizations. And so I think we would need to see an increase in hospitalization rate for that score to continue to increase in that particular region of the state. So an increase in case numbers alone isn't going to necessarily trigger. I mean, I think that's why we saw it go from a 7 to an 8 yesterday, because we did have an increase in case numbers. But the other thing that would factor into that would be an increase in hospitalizations.
I think Governor, too, I think you mentioned it a little bit. LULAC sent a letter last week, Attorney General, talking about we get more languages in all the different areas.
Yep.
Health and
Yep.
other sites. Is that something that you're doing?
Oh, well, absolutely. We want to be as transparent as possible, and that's been the goal from the very beginning. I know the Department of Public Health did have some COVID responses available for several weeks on their website, but we can do better. So we are working with the Department of Human Rights, and they're contracting with somebody to translate, like the press releases and some of the summary of the data that we have, into several different languages. So I really appreciate LULAC reaching out, and we've had some of it in place, but as I said, we can do better and apply that to some of the other information that we're putting out there, and so we'll get that tied in to the coronavirus.iowa.gov, so it's in one spot and really accessible to Iowans. So hopefully, hopefully, I forget, it's today Wednesday? Okay. Maybe by the end of the week we can start that process. I know Director San Juan was already working on that, so we intend to do better, and we should, and I really appreciate them reaching out and letting us know that that was a concern.
Last question in the room, by the way.
Governor, you made references to a peak in Iowa that's expected in the next couple of weeks. Could you be as specific as possible about what data you're referencing? And then what is that actual peak for Iowa? And then when do you make a decision about what happens on May 1st, given that so many of the sectors that are being impacted by the sort of orders to close have to make plans now about what they're going to be open?
Yeah, well, everybody should be making plans, because at some point, as we base the decisions on data, we want to open up this economy. And, really what we talked about today at the press conference, there are a lot of unintended consequences that are happening from the mitigation efforts that we put in place, which were essential so that we could protect vulnerable Iowans, that we could make sure that we didn't see a spike and overwhelm our hospital systems. We're seeing that. I think it's looking very good right now, and to make sure that we flatten the curve and that we are at a place when we can open back up. So we continue to look at the data and where it's at, but at the same time, we're looking at what things we can look at to start to dial back up and start to open up areas of the state. And it may be, Northwest Iowa right now, the numbers are really low, and so we'll take a look at what it looks like up there and what some of the criteria is, and we can start to apply that throughout the state. So, we want to get things up and going. We have to do it responsibly. We have to be cautious in how we do that, because we don't want to just flip the light switch and then, have another spike happen in a week. That's not going to be beneficial for anybody. We don't want to open things up only to say in a week we got to shut it back down. And so we have to be strategic and thoughtful and responsible in how we do that. And as I have done with everything, or there might be areas that I need to just, really take a look at in some of our hot spots and see if there's additional things we need to do there too. Maybe it's an additional testing, so we're looking at all of that all as we move through this. I can have Sarah talk about the peak. That's some of the modeling, they look at to project that. But again, I'm sure she'll say it is modeling that they're looking at, and so it's only as good as the assumptions that are going in. Sarah?
Right, and Sarah, to a follow-up to that, what role does testing play in making the decision to open up sectors of the state if there is a shortage of testing?
Sure. So you're highlighting some of the challenges that we've had. I think what we're basing our estimates on in terms of when are we going to see a peak in Iowa is really based on the experience in other states. And so we're understanding, from the time that they started to see case onsets and from the time that they started to put mitigation efforts in place, what did their peak look like? And it looks like that was about 4 to 6 weeks from the time that they really started having aggressive efforts. And so that has been kind of the information that we've been using to estimate middle to the end of April. I think we're starting to see our positive case numbers start to level off. Now that will change as we do targeted testing. So as Governor Reynolds mentioned, we're going to do some increased testing in Columbus Junction related to that plant, and we're going to get some additional testing supplies there. So, that could increase our case counts. I think as, we do more testing, we might find more cases, but those might be cases that we wouldn't otherwise find if they are employees that are experiencing mild illness and they hadn't gone to their doctor to seek testing and that sort of thing. So when we talk about where did we come up with the information to identify when our peak was going to happen, that was really based on experience that we've seen, from other states. I think we've seen our case counts kind of start to level off as we do some more of this surveillance type testing, which is what is going to happen in Columbus Junction, where we're going to surveillance test and do testing on people that might not be showing symptoms, might not otherwise be ill. We might see our case counts come up. But the reason that we haven't done widespread surveillance testing in our state to date is because we just haven't had the testing supplies available to do that. So hopefully that answers the question.
But if you don't have widespread testing, isn't it a gamble to open up parts of the state?
Well, I'll let Governor Reynolds address that
Well, it's
question.
a piece of the information, and we're hoping we can continue to do more and more testing. So we'll be anxious to update Iowans on that aspect, hopefully maybe tomorrow. But it is important, and it is part of the equation. But again, it doesn't reflect everything that's happening. If you look at the map, the information that the Department of Public Health is now providing on the website, you can hover over the different counties, and you can see that testing is happening in every county across the state, and it shows the number of negatives and number of positives. So it's not like, half the state up in northwest Iowa, they're not even being tested. That's not the case. There's actually testing going on across the state. But every governor you talk to, the more testing that we're able to do, that helps, especially when you can do some of the surveillance testing that Sarah talked about to get a better sense of what's happening, because a lot of people are asymptomatic. And so to get a better understanding of that and to do the contact tracing so we can see who they have potentially been around and exposed and what that looks like, to give them a heads up, to be looking for some of the symptoms since they have come in contact with somebody that tested positive, all goes a really long way to allow us to really target our approach and where we need to really concentrate our efforts on, like our long-term care facilities, because we know that those are such vulnerable Iowans in these facilities, a packing plant, because it's close proximity. So it really allows us, I think, to target our responses in a better manner.
All right, Dave, go ahead.
Morning, Governor. Earlier this week, I think it was Monday, you talked about that you were going to be meeting with your economic recovery task force. Can you tell us who is on that group, and can you talk about maybe some of the specific metrics you all will look at to decide how to reopen, whether it's in stages, geographically, what sectors of the private world, how you're going to decide on this?
Yeah, Dave, so that's why we're creating an economic recovery task force, because we're going to start with phase one, and we'll have the different agencies around the table to start to talk about what some of those questions are. What should we be looking at? What are some of the metrics we should be applying? What does it look like to stabilize? What does it look like to recover? And then what does it look like to start to grow the economy? So it's different phases that we'll be working through. So we'll start initially with a lot of the directors and department heads that have been really involved in the COVID response, and then we'll start to kind of frame up the timeline, what we're looking at, and then what some of those subgroups may look like. Agriculture is really hurting right now, and that's a significant part of our economy, so that's a sector that we need to look at. The restaurant and hospitality industry, how do we recover from that? So the phase two will be bringing in business and industry and outsiders to start to sit down and get their input on what it looks like to start to really stabilize, recover, and then grow the economy in Iowa. So I wasn't being flippant. We just are at the very beginning stages. We'll get the directors together tomorrow, start to walk through some of that. We can get a list of the agencies that will be involved in that. But phase 2, I think, is what you're probably going to be more interested in. That's when we bring the private sector into the discussion and start to really do a deep dive on what it looks like to start to open things back up. And those metrics that you talked about. We're already working on them, but to get some feedback and input from industry is really going to be important.
Aaron at Lee News.
Thank you, Governor. The new data on the dashboard features confirmed cases, share of confirmed cases by race. I'm wondering if we also have data, and maybe Sarah needs help on this, but if we have data on just pure number of testing being done by race, and I guess what I'm getting at is so that we know, do we have data that shows that we're testing in all of our different communities across the state?
Yeah, thank you for the question. One of the way that information is currently gathered is through our interviews with patients once they've been identified as a positive case, and so that is a contact with local public health, and we're collecting some of that information at that particular point in time. And so because of that, and because sometimes that information can be so granular, especially in a state like Iowa, we've decided to not release numbers, and so we'll continue to just provide percentages of cases related to that particular source of information.
Rod, go ahead.
Thank you, Governor. Kind of getting back to the testing issue as it relates to reopening the state.
Mm-hmm.
With over 3 million residents, what level of testing would be needed to adequately assess whether businesses, schools, and others can reopen? And would that be like 1 million or 2 million or more? And also, where would those test kits come from, since about 20,000 Iowans currently have been tested? Are there plans to ramp up the state hygienic lab abilities, or would those kits have to come from outside sources? And also, would there have to be some kind of a ID system afterwards to indicate people who have cleared and are safe to go back out into their businesses?
Well, I'll let you talk about the serology testing that's taking place, which is exciting. We're on the front end of that. So again, we have to wait for testing supplies before we're able to do that. But I believe, I'm looking up, Dr. Padati told me yesterday in the state of Iowa that we've actually tested 1 in 160 Iowans have been tested. And so that's, we can do more, we should do more, but that's actually, I think, pretty good. Is that number correct? I think that's right. So we are making progress. We are testing more. We have been somewhat, limited with the state hygienic lab testing that we're doing, but as you can see, we're opening that up every day and really targeting using those tests to target where some of the hot spots are at. But Iowans still have access to the other labs and other testing. If they're feeling that they have symptoms, they just need to call their physician, the doctor, the clinician, and they'll go through the assessment with them and make the determination if they need to come in and get a test or not. So those are still available. And I think we're just seeing a lag because of the holidays, because it takes a little bit longer for those test results to come back in. But that continues to be a very good option for Iowans. If they think that they are symptomatic, call the clinician. Don't go in, call them first, and they will walk through a series of questions and make the determination on what you need to do. But we're going to continue to look for opportunities to bring more tests to the state of Iowa, because we know that that'll be a big piece of it'll be something that we can utilize as we talk about opening the state back up. In addition to, again, I've mentioned the tracing, which is really, really an important component of that too. And the Department of Public Health, our local Department of Public Health officials have been doing this at the county level, and really put in a heroic effort to really get in front of this and do the tracing that needs to be done, so we can really get some sense of who's been exposed and how we can start to continue to mitigate that spread.
2 more questions. Natalie at Iowa Public Radio.
Hi, Governor. I wanted to hear a little bit more about how you're planning to do some of the contact tracing, especially in rural areas where health departments are supposed to be
Oh, they do that, yeah.
Yeah, thank you for the question. So you're right. Our local public health partners are fantastic, but in a lot of cases they have limited resources and limited staffing. And so we are actually working on setting up additional contact tracing support through the state so that we can help those local health departments to the extent that they just don't have resources available to get a hold of all of these positive cases when they're identified. And so we're working at the state level within the Department of Public Health and with our state agency partners to stand up additional contact tracing teams. In addition to doing the initial interviews with positive cases, these contact tracing teams will also be following up with people as we move forward to see how they're doing, to help us update those recovery numbers. And so we are currently working to stand up additional resources to be able to make sure that our local health departments, especially in rural areas that don't otherwise have capacity to do the contact tracing that's needed, to provide that for them.
So we'll have more information on this tomorrow, and actually Director Garcia in the Department of Human Services is going to be a key component of that, providing resources so we're able to do some of the contract tracing. So she'll maybe be with us tomorrow when we talk more about that.
We just got one more question, and we'll go to Ryan Foley, the Associated Press.
Thank you. On the meatpacking plant, are state agencies doing any on-site inspections to ensure that the plants are actually implementing the worker safety protections that they have promised? And beyond Columbus Junction, are there any plans to do mass testing of workers at other plants, including those in Tama?
Yeah, yes, there is. We have 18 packing and food processing plants throughout the state of Iowa, and as I've indicated, we've made initial contacts with them. Department of Ag does site visits and inspections with the USDA to all of these sites. But we're going to continue to reach out and provide the testing that they need to make sure that we can protect their employees first and foremost, but so that we can have healthy employees that can keep the plant up and running and continue to make sure that that food supply is working its way to our grocery stores and to Americans and people all around the world. So we are continuing to work on that. We'll continue to work on that. I have a call with Secretary Perdue today. We've got a call in to CDC to see if they can provide even some assistance at our packing plants as well. So we're all of the above to make sure that we can continue to protect our employees, but also make sure that we really protect this critical essential infrastructure as well. So thank you.
Yeah, I think so. We're all off, right? Yeah. No? Not too bad.